Hi, everyone. Thank you so much for coming to see me today. I hope that I can open some windows of information surrounding the legislation in the UK regarding fertility treatment. So, just to introduce myself, I've been in the fertility sector for just over 20 years. I started as an embryologist at the Hammersmith Hospital and then worked privately, but also in the NHS. I joined the London Women's Clinic and became the lab manager and then ran the sperm bank. So I've got a special interest in donation. I'm now working at Guy's Hospital. So I'm back in the NHS again as the quality manager there. Um, I'm very interested in regulation, but also, of course, very interested in the science of it all, since that's where I came from. And I'm also a member of the HFEA Licensed Centres panel. So we get to discuss things that are coming up in the sector and hopefully offer good guidance to the clinics in the UK. So just to start us off, I thought we should start. Oops, sorry. I'll just give a rundown of what I'm going to be looking at today. So I want to look at the history of IVF and how it all began. Also the Human Fertilization and Embryology Authority and what that actually does and how that can help you as patients, but also look at particular topics that may be useful to you if you're embarking on treatment or are already undergoing treatment. So you'll all know about Louise Brown. She was the first IVF baby to be born. There she is. And this was through the help of Bob Edwards, Patrick Steptoe, and also Jean Purdy, who was the nurse at the time. Louise Brown was born in 1978. She's doing really well. She's got her own family now. And obviously, when this happened, people became very concerned about how IVF would affect the population. Things were very different then. And as a result of that, the Warnock Report was born. And this gave 64 recommendations as to how treatment in the UK could be regulated in the best possible way to ensure that the patients are protected and nothing unethical is done. Oh, my slide isn't, there we go. So it all started off with the Human Fertilization and Embryology Act of 1990. What it did was look at regulation. It looked at other medical services such as embryo storage, and it also looked at embryo research. The HFEA was born to become the regulator after the 1990 Act, and this makes sure that fertility clinics and research centres comply with the law. Now, as someone who works in a fertility clinic, I'm very aware of the increasing number of people that are coming through for treatment, and that's why it makes regulations so important. Increasingly, as you can see from this graph, both fresh and frozen cycles are on the increase. And this kind of data is actually collated by the HFEA. And what it allows us to do is actually ensure that we can get all the data from the treatments that are occurring in the UK. And as a result, do good research and work on ways to improve our services and our treatment of patients. Now, the purpose of the HFEA is very clear. It works for the Department of Health, but not as part of the Department of Health, but it answers directly to the government. It's involved in licensing of clinics. Now, all clinics in the UK have to have a license to be able to practice. These licenses can be a maximum of 4 years long, and during that time, you will be inspected. Generally, inspections occur every 2 years, and these are planned inspections. But also, what also happens, you can have unannounced inspections, so when the inspectors just show up. But also, if there's an incident at your clinic, what will also happen is they may do some further investigation. Now, obviously, with COVID, things have been a bit different. All the inspections have been desk-based, so it'll be interesting to see what happens next year with regards to the inspections, because it's been quite a hard slog getting all the paperwork sorted out and all correct. They also work with the CQC, which regulates hospitals in the UK, to ensure we offer appropriate standards of care. They've also developed a manual called the Code of Practice. It's currently on its 9th edition. And what that does is provide guidance about the different treatments that you can have, how we should treat our patients. It summarises the qualifications that staff members need to have to be able to practice. And also, it's just generally a guide about the law surrounding treatment and what the clinics can follow to ensure they're acting lawfully. So how is the HFEA relevant to patients? Well, as I said, it does the regulation, which is very important because it ensures that you get good treatment, but also it can provide unbiased information. Now, it does this in the form of providing leaflets or brochures that you can request through their website. It also collects information about every treatment that's undertaken in the UK, collates all that data together, and then provides those graphs similar to the ones I've shown a little bit earlier. Now, this is relevant because it makes sure that funding in the UK is sent to the right areas. Of course, there's always a lot of discussion about how difficult it is to get NHS treatment. However, what it does do, it does show the areas that perhaps need a bit more funding. Now, since most of IVF cycles are privately paid for, what it also ensures is that you get a practical guide to which clinics you can use for the type of treatment that you need. Now, this includes the services they offer, where they're geographically located, and also what doctors, nurses, and scientists are working there. Now, what I would say is on a practical level, it's really important if you are embarking on treatment that you consider where you go. Um, Being close to where you live, your clinic, is really, really helpful. The process is stressful enough without adding a 2-hour journey every time you need to go and visit a doctor or a nurse. What the HFEA website does, it allows you to search for clinics in your area in a really, really straightforward way. It also gives you pregnancy and outcome data for those clinics. And what I would say is, though, when you get that data, you need to bear in mind that it's about 2 years old, because what they have to do is obviously they collect all the data from all the clinics and then they have to analyze it and validate it. And that takes a little bit of time. So the most useful outcome data for you to get is actually directly from your clinic. Now, that will involve just asking your clinic for success rates, so pregnancy rates and live births rates, for someone in your age group or with your particular requirements. So, for example, if you're using donor sperm, or if you're if you're 40 and above, or if you need any other particular thing, if it's a male factor issue, then it's worth asking for success rates that are exactly related to your position. A lot of the HFEA success rates are quite general, and obviously you want to know your personal position. Also, if you have treatment with a clinic that's licensed by the HFEA and you're unsatisfied by it, you can give feedback, and also they can resolve complaints if necessary. But of course, we hope that you're not going to have a bad experience, and that your own clinic will be able to sort out these issues for you themselves. So the specific areas of regulation I want to look at are consent, for example, and also multiple embryo transfer. Both these things generally affect everyone. As I said, I've got a particular interest in donation, so we'll look at that, as well as looking at legal parenthood and other techniques that are available for you, both on the NHS and privately. As I was saying about the HFEA providing brochures, here's a couple that they've produced, which are quite interesting. There's more recent ones. They've just published trend analysis for treatments that have been undertaken, and that was released in May. So that's obviously very up to date with lots of data surrounding births and pregnancy rates. Now, consent. Obviously, one of the most important parts of your treatment is to make sure that you understand what you're being treated with, how that will be done, and how that will affect you in the long term. And for that reason, the HFEA have created a whole pack of consent forms that should follow you through your treatment. Now, what will actually happen is you'll be provided with these forms at the beginning, so they need to be completed prior to any kind of egg collection, embryo transfer, or insemination. And the most obvious one to look at first is the consent to disclosure form. And this will be given to you before you start your treatment. And it's important because it allows us to talk to your GP, if you have one, other healthcare professionals, but also it ensures that we know who you're linked with. So, for example, if you're coming through with a partner, it allows us to know if we can discuss your case with them as well. It also allows us to be told whether you're happy for your information to be passed on to research bodies, which of course is very important to ensure that our treatment processes become better and better. Also, you'll be given forms to cover your treatment. So as you can see here, we've got a woman's consent form, a men's consent form, and more recently, the gender neutral forms were also created. Within these forms, you're allowed to consent to the type of treatment you'll have, the creation of embryos using your sperm, your eggs, or those of a donor, and also to the length of time you want these embryos to be stored for if you're lucky to have surplus ones after your treatment. This is also really, really important because it will connect you with your partner so that they can use your embryos or eggs or sperm if necessary. And also, in the event of your death, we'll know what the idea is and what you want us to do um, with any gametes that we still have in storage for you. So, as I said, it's really important that these are completed in advance. The website also has a lot of information to help you complete these forms. And of course, these forms you are exactly identical in whatever clinic you go to in the UK. Also importantly, as part of the consent process, what the HFEA insists on is that you have access to counselling. Now, lots of people get really, really involved in the actual treatment process, the kind of like the practical elements of it. But what we need to make sure is that you're supported emotionally as well. And for that reason, it's a regulatory issue for the HFEA that each person is offered counselling, usually free of charge, to discuss the implications of your treatment. Now, that actually includes, and particularly if you're using donor gametes or donor embryos, because what we want to make sure is you know the long term implications of that for you and your family. Um, Now, another thing the HFEA regulates against is multiple births. Now, basically, historically, it was very common for twins and triplets to be born, which obviously had a massive impact on the special care baby units in the UK. Um, a report was done in 2006 which produced these two grafts, and you can see that the number of twins and triplets continued to increase at a massive level. So what the HFEA decided was that they needed to look at a way of regulating this process to reduce the number of twins, reduce the number of triplets, but not impact on the chance of you being pregnant. Now, lots of people decide that um, if they have two embryos back, they have more chance of having a pregnancy. It's been proven repeatedly that that is in fact not the case. If you have two embryos back, you're more likely to have a twin pregnancy, not increase your chance of having a single pregnancy at all. So what we tend to encourage people to do now is to keep their embryos, if they're having IVF, up to day 5, which is the blastocyst stage. And by that stage, your embryos will have largely decided which is the best, which is developing the most nicely, and therefore which one's most appropriate to be transferred. And also, because we have such great freezing processes now called vitrification, blastocysts can also be frozen and therefore not wasted. So what that means is you can come in for your first cycle, have a single embryo transferred at the blastocyst stage, which is day 5, have a good chance of pregnancy, and then hopefully come through later on to have a sibling, all in the safest possible way. Historically, when embryos were transferred at earlier stages, so for example, day 3, it's much more difficult to decide which ones are the best, and therefore people tended to request to have 2 put back. It is now actually against the law to put more than 2 embryos back, unless you're over the age of 42. Most people are encouraged to have 1 embryo back, and most clinics have their own multiple birth minimization strategy that they use to ensure that they offer their patient the most appropriate outcome. Now, this may be related to your age, the quality of your embryos, or the number of treatments you've had already. Again, as I said, to have 3 embryos back is very unusual, but to have 2 back is much more usual if you're over the age of 40. So as you can see, their strategy worked really, really well. They were aiming to make sure that clinics only had 10% multiple birth rates. They kept a really close eye on it. And as you can see from this graph, it's now actually very unusual to have 3 embryos put back. And increasingly, and even more so now, most people are opting just to have 1. In comparison, the success rates continue to increase. And also, thankfully, the number of healthy live births continues to increase. And it's difficult to not say that this is linked to people deciding to only have 1 embryo back at a time. Some clinics have objected to the HFEA legislating regarding the number of embryos to put back, but so far it's worked really, really well for most clinics. I know in the clinic that I work with, the multiple pregnancy rate is 3%, and we're really proud of that because we hope that there'll be healthy births too. So, donation. So as you can see from this graph, also published by the HFEA, the number of cycles that use donor sperm and donor eggs is on the increase at all times. This is for a number of reasons. Firstly, more people are accessing treatment. Obviously, we're increasingly treating same-sex couples and single people coming through. As you can see, there was a small dip in the use of donor sperm, and that's largely been put down to the increased use of ICSI during this time, which means that you can inject one sperm into each egg. What this meant, therefore, is that men who had very low sperm counts and previously were told that their only chance of success was using donor sperm could try with their own sperm first. But since about 2010, the amount of donor sperm in particular being used has definitely increased, and also it's become more acceptable to use donor eggs. So we're really, really happy that people feel comfortable now going forward and using donor eggs, and in some cases using donor eggs and donor sperm, and still going on and having happy and healthy pregnancies. In the UK, the legislation surrounding donations is actually some of the most strict in the world. And so I just want to talk you through a little of things you need to consider and think about if you are using a donor. Now, since 2005, donation has always been ID release. Prior to that, you could be an anonymous donor, which basically meant you could come to the clinic, donate your sperm, and not think much more about it. But it was decided that this wasn't actually helpful to children that were born from donation, and so the law changed. Now, in 2005, 2006, everyone was panicking that we wouldn't have any donors because nobody would want to be ID release. And in fact, at that time, I was actually running the sperm bank. And I too had that concern. But in fact, what we did actually see was a different type of donor coming forward. There were less students, more guys who were a little bit older, maybe even had a family of their own. And so, in fact, losing the anonymity status was not a problem at all. What that actually means is when they donate, they agree, all donors, egg and sperm donors, agree to sign up onto the donor register. That includes all their identifying information. The most important elements of the register is that when the child who's been created from the sperm reaches the age of 16, they can approach the register to confirm whether they're genetically linked to somebody they know. That's obviously to ensure that they're not involved in a relationship with a half sibling of their own. Now, this approach to the register doesn't need to be backed by parents. It's a case of the offspring making the decision themselves. They'd also be given additional non-identifying information and have access to the pen sketch that the donor may have provided and any other information like a goodwill message. At 18, also what then happens is they can approach the register again and request the identifying information. So this includes full name, last known address, and date of birth. And obviously, it's really, really easy now to trace them without just that information. The plan is, and the hope is that if contacts are made between donor offspring and the donor, that this will be through a mediation service. And I think it's important to know that the donors don't get any access to any information. This is largely to ensure that children that don't want to meet their donor don't have to. Um, but from my experience, most donors are really, really happy to be contacted. Another important element is the fact that in the UK, donors can only contribute to a maximum of 10 families. That doesn't mean 10 children, that means 10 families. So if a family decides to have 4 children, of course, potentially the numbers of siblings or half siblings can add up. So we generally expect up to 20 siblings or half siblings. What you do need to bear in mind, if you are using a donor from overseas, so a lot of people increasingly import sperm from America, for example, you need to consider that the limit of 10 families is only limited to the UK. So if that donor is being used elsewhere, it may mean there's a cluster of families in, I don't know, America, Australia, Denmark, Europe, wherever. So you need to consider that if you decide that you want to import samples, either sperm or eggs from overseas. And again, if you did want to do that and have your treatment in the UK, those donors could not be anonymous. Increasingly, people go abroad for treatment. The most common one is obviously Spain. They do some anonymous donation, but it's really important if you do that, you do need to bear in mind that you won't be able to have subsequent treatments in the UK using those embryos because the donor is anonymous. If you did want to do that for a sibling, you would have to make a special request to the HFEA, and the positive outcome is not guaranteed. So if you are using donor sperm, it's really important to understand legal parenthood. Now, the reason this came to pass was because in 2009, the law changed such that people that were not in a civil partnership or not married were able to become legal parents. Now, the way to accomplish this is by filling in two forms, the WP and the PP form. And these again need to be completed prior to treatment starting, so before donor insemination or before you have embryos created with that donor. These forms felt quite complex when they were first introduced, and as a result of that, the HFEA decided to do an audit of clinics to ensure that they were completing these forms appropriately. Unfortunately, there was a number of cases that were picked up where the forms were not completed correctly, and that led to a lot of clinics being taken to court and having to pay vast sums of money, as they should have done, as they should do, to ensure that the second parent would be recognised as a legal parent. Thankfully, people's understanding of these forms now and training that has been received throughout the UK is so much better that these errors are really, really rare. But even so, the HFE feel it's still important to regulate on this matter, so all clinics do keep on top of it. An additional form that was introduced was the PBR form, and this ensured that if you filled it out and you had spare embryos in storage, it would ensure that the second parent would be able to be registered as a legal parent even in the event of their death. So if you do have surplus embryos created from donor sperm, it's really, really important to ensure that this form is filled out effectively and accurately. Um, Another thing that we actually do at Guy's Hospital is pre-implantation genetic testing. This isn't offered at all hospitals, but it is offered at some. And if this is something that you need, it's important that you do your research. Now, pre-implantation genetic testing was formerly known as PGD. It's only recently changed, so it's still often referenced as PGD. So that's pre-implantation genetic diagnosis. And this is for those patients coming through that they have a known disease in their family that's genetically linked. Quite often these families do actually already have an affected child, and therefore it's a very emotive treatment to have. The HFEA licenses treatment because, of course, it's really important that it's done in an ethical fashion and done only by people who have got the best experience and best qualifications. Now, so far in the UK, there's about 600 genetic conditions that are licensed, but that doesn't exclude other genetic conditions. If you have a disorder that currently isn't being tested for, your clinic can actually apply for a license to do that testing. And as long as it's proven necessary, those licenses will be agreed. And what that means is that you have your embryos created and then they are biopsied and tested to ensure that the embryo that you're having replaced is not suffering from the disorder that you've previously experienced. The most important thing to remember about this is for medical testing only. In the UK, we're not allowed by law to sex select for family balancing. So in the US, for example, you're able to have things like sperm sorting, which allows you to be able to select whether you want to have a male or female child. But in the UK, that's actually against the law, so it's not done here. Now, finally, I want to talk about treatment add-ons. Again, this is a thing that the HFEA have studied very, very carefully. When you have your treatment, there's routine IVF procedures, routine ICSI procedures, lots of techniques that we accept on a day-to-day level that have been proven to be really effective in helping you have a child. The difficulty is that when you're having treatment, you'll often be prepared to do whatever it takes to try and increase your chances. Now, most clinics are very sensible and very straightforward and will only offer you treatments that will be helpful. But there are some clinics that do offer treatments that it's quite unclear whether they'll actually increase your chance of a pregnancy. And increasingly, these are in private clinics where you have to pay additional costs. So for that reason, the HFEA created a traffic light system where those techniques that we know work well and do prove effective, and also a number of studies have been published that are of good quality. These are the green techniques. Those on amber, there may be some studies that say it's helpful and some studies that say it's not. But what's important is that this research is of good quality and further research is ongoing. An example of this is embryo glue that many clinics use at the type of transfer to try and increase their rates of implantation. And then there's the red techniques. Now, these are things like assisted hatching, which used to be very, very common historically. But these are techniques that there's no evidence to show that actually improves your chances of success. There's no decent research. That's not to say that there won't be in the future, but currently there isn't. So these are the techniques that the HFEA suggests you should avoid. So if you do go to your clinic and they offer you something in addition to your routine IVF or ICSI, it's important to go to the website and double check where they stand with regards to research and effectiveness. Now, I've kind of given you a bit of a whistle-stop tour of IVF regulation, and I just wanted to start to end on this really nice quote that comes from the HFEA website, because regulation can seem a bit dull and a bit unnecessary, but in fact, I'm going to read this to you because I think it's really, really good. Regulation is important because it ensures that the work carried out is at a certain standard, that only qualified people can do it, and that research on embryos is only done where there's real need and in a way that's ethical. Of course, that's really, really important when you're trying to create your family. I hope you found this really useful. Please feel free to ask me any questions that you have. As my colleague said, I'm happy to answer related to things I've discussed, but please feel free to ask me anything else you may think may be useful to your journey. Thank you very much.
Thank you so much indeed. Definitely thorough presentation. You have provided lots of details and maybe some of those were definitely new for you. So I'm glad that we were able to discuss this tonight. And I believe that now when it comes to IVF law in UK, it's a little bit more clear for you. And now it is definitely time for your questions. I do see some people are typing, so don't hesitate. As Vanessa said, right? Anything that's on your mind, go ahead, type this in. And she's here definitely to help you out. And let's have a look. The first question is from Melissa. Let's have a look at this. Do you know if it is possible to get IVF on NHS if you are single?
So, Melissa, hi. It basically, unfortunately, depends on where you're actually living. It also depends on your age and other factors. So what you need to do is approach your GP and ask them about the status in your particular area. Increasingly, it's been recognised that not treating people that are single is actually discrimination. And if you can get hold of the sperm that you need to be treated, it's very likely that you will be able to get the treatment you need. Of course, you need to think about what treatment's best for you. If you're over the age of 36, you maybe want to consider IVF. Below that age, you might want to think of donor insemination. But as I said, unfortunately, it is dependent on where you live. Now, I think early next year, a lot of the IVF funding pathways are going to be reviewed. So if I was you, I would go straight ahead and start looking into it now, just in case things get a little bit worse after the funding's been changed by the government. I hope that answers your question.
So much, Melissa, of course, for your very first question, and Vanessa for helping out. And of course, if you would like to add anything, Melissa, go ahead, do it, of course. Let's have a look. Next question from Natalie is right here as well. And what is the legal parenthood status for parents who use embryo donation?
Okay, so as soon as a person becomes pregnant with an embryo, and as soon as that birth takes place, the person that's actually carrying the pregnancy becomes the legal parent. That's just automatic in law. Now, if you're married or in a civil partnership, you automatically also become the second parent. However, if you're not, it's really, really important you fill in those forms just to ensure that your legal parenthood is recognised. I did describe the WP and the PP form earlier on in the presentation, and what you'll need to do is look at your assess that against your actual situation. Some people decide that they want to get married or into a civil partnership to avoid filling out all these forms, but I would actually suggest that you focus on your treatment and just fill in the forms accurately, and as I said, before you have any treatment. If you can get a donor embryo in the UK, that is fantastic, because embryo donation is actually quite unusual, so I really wish you luck.
All right. Again, thank you so much, Natalie, for your question, and Vanessa for helping out with that as well. And let's have a look at this one, okay? Sorry, Melissa has also added, so 43, so I guess it's not possible just for schools.
Oh, well, Melissa, actually some areas, depending where you are, do treat up to the age of 43, as long as you're not hitting 44, you may still have a chance to get right on it.
All right. Thanks for the confirmation. Thanks so much
No
indeed.
worries.
Okay, let's have a look. Okay, I'm doing donated embryo transfer. Will I need to fill form to be known as the legal parent? I am single.
Okay, so as I said, because in the previous question, because you'll be actually carrying the embryo yourself, you'll automatically become the birth parent and therefore the legal parent. So you wouldn't need to fill in those forms. It is, however, important to make sure if you are using donated embryos that you get as much information as you possibly can beforehand, and that your clinic will have the donor appropriately registered. Now, this would involve registration of both the male and the female who created the embryo in the first place. It doesn't matter if you're single.
Right. Thank you so much in this case for the clarification, and I do believe that was helpful for you. So let's have a look. Okay, more questions are coming up. Natalie has added one more question. Can you choose who to donate your embryos to?
Okay, so as part of the consenting process, you fill in the form, and there's a section that talks about what to do with your embryos after your death, when you no longer need them. There is the option to donate your embryos to either research or to another patient or to someone known to yourself. And yes, you can do that, but what you do need to bear in mind is that you will need to have a number of additional screening tests to ensure that you are suitable as a donor. So, for example, you'll be screened as a donor would be screened. So, additional blood testing, genetic testing, all these things that you wouldn't have for your own treatment. So if you then want to donate it to someone you know, they would then be treated as your recipient, or you can donate them to an embryo bank who will then find a recipient for you. It's also important to remember that you too would be on the donation register, and so therefore any child created from those embryos would then have the right to your identifying information when they reach the age of 18, as I explained earlier.
Perfect. Thank you so much again for
No
the
problem.
clarification, and Natalie for your follow up. And now Angela has another question. Is genetic testing similar to the InVitae for 301 carrier diseases done in the UK? If so, is this covered under the NHS?
Okay, so the testing that you can get for all these different disorders is slightly different to PGD, because what you actually do, or PGT, sorry, what they actually do is they only test for one particular disorder, and that will be the disorder that's relevant for your family. So common things are things like haemophilia, Huntington's, and also cystic fibrosis. They're the most common ones. They don't do a whole spectrum of testing. That's not how the embryo testing actually works. And again, it would only be covered in the NHS, this kind of testing, if you had a proof that within your family you had this genetic problem, and generally you would have already had an affected child. I hope that answered your question.
Excellent. Thank you so much
No
indeed.
problem.
It's another question. And there is one more, okay, from Angela. Okay, sorry, there's a comment before the next question. No, the InVitae test is not on the embryo, it's on the intended parents via blood. I wasn't talking about PGD 24.
Oh, okay. I'm sorry about that. We don't actually do screening of the parents. And what we assume is that any testing to be done on the parents is the only things we do are infectious diseases. We don't do genetic screening unless you're planning on donating your embryos or your sperm or your eggs.
And thanks, Angela, for the clarification. I do believe that now it's all good for you as well. Let's have a look. Okay, more questions are coming in. Can I use my sister's eggs if she lives in country where donors are only anonymous? Czech Republic. The clinic has branch in London and also in Prague.
Okay, so if you want to use a donor, so in this case your sister's eggs, and she lives abroad, there's two different ways you can do it. If you want to do anonymous donation, so she wouldn't be anonymous to you though because she's your sister, you would need to go to the Czech Republic and have your transfer. The issue is surrounding this is if you then wanted to have subsequent treatment, you wouldn't be able to bring any embryos over from the Czech Republic to be used in the UK. The alternative is that your sister comes to the UK and donates her eggs here. She would then, of course, have to be on the register as a donor, so it would make her non-anonymous. But I guess known donation can be very, very complicated. It would be unusual for the donor to be anonymous if it is a family member. But there are lots of clinics that have different locations. So work from London and Prague, as in this example, but also London and Spain is quite a common one. I'm not sure how unless you are not intending to tell your child, in that case it would be safer for you to have your treatment abroad, because of course there's no chance that your child would find out. However, we don't encourage that in the UK, because it's felt that children benefit from knowing where they come from genetically. This is kind of a thing that you really would discuss with during your implications counselling, because obviously you want to make sure you're going with your eyes open for any treatment that you have.
Thanks so much. Of course, this is like a more complicated thing.
This is a very complicated question.
Exactly, different aspects of it. So before any decision is made, definitely counseling would be needed. Thanks so much for an interesting question indeed as well. Okay, let's have a look. Angela has added one more question. So is there a chance that if a surrogate gives birth, that a judge will rule that the surrogate will be the mother? How long would it take to get the birth certificate changed to the intended parent?
Okay, so the HFEA have done a lot of regulation around surrogacy. To be honest, I probably should have included that in my presentation. The important thing to note is that because you'll be given particular forms that ensure that the surrogate is signing over her rights to you as the intended parents, that starts the ball rolling. Unfortunately, that doesn't automatically mean that you are the parents. 6 months after the birth, generally, you would then go to court to get full parental rights and full legal rights. The way you do this is by making an application before the child reaches the age of 6 months to the courts. And generally, as long as you haven't paid your surrogate too much money, because expenses are capped in the UK, there's no problems at all. It's also very, very rare for a surrogate to decide to keep the baby. And also, as long as you've got all the paperwork in place, also the clinics also generally insist that the surrogate and the intended parents and the partner of the surrogate, if they have one, go through extensive counselling to ensure that all parties are on the same page when it comes to the treatment. If there's any doubt that you feel that your surrogate may decide to keep the baby, then that's not the surrogate for you. I know it's really, really difficult to find surrogates, but I can assure you that lots of protections in place to ensure that the intended parents receive the child as they should. But again, forms must be filled out before treatment. It's absolutely crucial.
Of course, that makes perfect sense. Thanks so much, Angela, for yet another interesting question. And there's this, we were able to talk about surrogacy options as well. So thanks a lot for sure. Okay, and let's have a look. Interesting question. Is there any shortage of donors due to COVID-19?
Okay, so at the beginning of 2020, the HFEA did close clinics for a period of 3 to 4 months in most cases. And what that did mean is that recruitment of donors was also stopped. Some clinics decided they wanted to stop the recruitment of donors for longer than that. But in reality, the majority of people do have, if they're a recruitment site, if they're a donor bank, do have enough donors still in storage to ensure that the supply is available. As I mentioned previously, you can also import donor sperm from overseas. The most common places are places like the European Sperm Bank and Cryos. Now, both of these understand the HFEA regulation very, very clearly, and they actually get their donors to fill in the same forms. So even if you can't find a donor in the UK, you can get these from abroad. If you really want to get a UK donor, generally there are donors available. Of course, if you're from a background that isn't Caucasian, things can be a bit more difficult. For example, it's particularly difficult to recruit Black donors and donors of Oriental descent. But if you're Caucasian, it's generally very, very easy to find a donor that's suitable for you.
And that's good to hear for sure. Thanks so much for that question. And someone is typing, so we need to wait a minute and see if we have another question. If not, we will be slowly finishing. But of course, we don't want to finish so before we see that you have asked all of your questions. And there's another question from Angela. Might be our final one. So if you have any more, go ahead, type those in. And the question is, do you think the law will change in the future so we can see photos of donors?
Um, the difficulty is there's been a lot of discussion surrounding this because there was one period when the HFEA discussed the option of perhaps making baby photos available. This is still in discussion. The discussion surrounding adult photos is rather different because, of course, with technology as it is today, it's very easy to then identify the person, which completely goes beyond what's expected by law in terms of identification of those donors. So, for the time being, I suspect that no, the law is not going to change to let photos be available. It may be that baby photos are available. I think it's unlikely. But what if that is something that's very, very interesting to you and something that's very, very important? Again, a lot of the American sperm and egg banks do provide that information, um, and you can import those gametes to the UK. You get the additional information like the photographs, etc., separately, and the clinic will then only get the information about screening, etc., and consent. But yes, that would mean you could have a photograph of a donor if you wanted to do so.
So there are still ways, maybe just different ones, maybe
Yeah.
not exactly in the UK, but if someone is sure that this is the way they would like to do it, then there are options. Someone
Yeah,
again.
everyone has different ways they want to protect
Exactly,
their family.
exactly. Of course. I'm just waiting. Someone is again typing. I just want to make sure whether it's another question or a thank you. But let's have a look. Okay. Yeah. There it is. Sorry. What would be the advantage of the UK if we can see photos and have more information on other countries with donors and surrogates?
I think the way things are set up in the UK is to ensure that children have the choice of whether they find out who their donor is. This is instead of the parents who are selecting the donor. I guess it's a personal decision whether you feel that's appropriate, whether you think that parents should be able to see what the donor looks like. But I guess it's all about the law in the UK allows that control to be handed to the child. Obviously, surrogates is a slightly different case because the surrogate will generally be known to the intended parent, so therefore photos aren't necessary. What would be the advantage in the UK? I'm not sure there would be an advantage. I think it's really, really important to consider other things when you're choosing your donor, rather than just physical characteristics, because, of course, if you're using your own eggs, then, or if you're using your partner's sperm, then that will mean that they will have an input into how the child's going to look in the end. I think also things like, some people feel that education, occupation, interests, those kind of things are more important. But again, you don't know if those are genetically inherited. Um, so I'm kind of on the fence about photos. At this stage, I don't think they're necessary in the UK because you can get them elsewhere.
Thank you so much. Indeed, interesting question again, Angela.
Very interesting.
So it's good that we are also talking about that. This is
Mm.
definitely interesting, and thank you for your opinion on this as well, of course, Vanessa. And as you can see, some of the things are coming up your way, so I guess we will be slowly finishing. Okay, Angela has added one more thing, so let's go to this one. I also meant treatments being more advanced, not just photos.
So I think it's less of a case of treatments being more advanced. I think it's more of a case of us getting better at the treatments that we offer. So all the time we're getting better at culturing embryos. Um, the better embryos we create, the higher the chances of pregnancy. We're also getting better at understanding the reason for the inability to become pregnant as well. So the assessments in the females and the males is getting much, much better. So we can identify things that are stopping you getting pregnant. Also, um, the availability of donors is obviously making things a lot easier, particularly for older women that want to have treatment. They get the opportunity to use eggs from a much, much younger person. And then you can think about the epigenetic episode. So how the person carrying the pregnancy then has an impact on how the child turns out in the end. A lot of work is going into improving our processes, and I think that's the way we should think about improving what we can do really well already, and then seeing what happens in the future. I suspect most things will become more genetically related than they are at the moment.
Thanks so much for for your follow up, Angela, as well. Definitely, it's good to it's just a little bit of a they are questioning you a bit more, in detail, but I think it's okay, right?
Yeah, of course.
Thanks so much, indeed. Definitely interesting. And one more, okay. Last question: do you have live birth guarantee packages?
So we don't offer that at our particular clinic. I know some clinics do that. There's also particular ways that you can organise the costing for your IVF through organisations that I've completely lost the name of the particular one I was thinking of. But there are organisations that you can approach that do offer that live birth guarantee. The problem is the amount of money that you have to pay up front is generally quite hefty. Because of course the expectation is that you'll have a lot of treatment, and then obviously if you get pregnant, excellent, but then you will have spent a huge amount of money when you could have perhaps been just as successful by going through a pay-as-you-go type situation. Sometimes some clinics do offer 3-cycle packages, for example, where you pay for 2 and you get 1 free, but again, that isn't a live birth guarantee. That's more about spreading the cost a little bit and making things a bit cheaper for you. At Guy's, where I work, we do a lot of NHS funded treatments as well, and that's a case of you being offered a certain number of treatments until you have a child, rather than a live birth guarantee.
Of course. Again, thank you so much. Definitely, again, interesting question. Thank you so much, Angela, for being active, very active, and asking all those questions. It's always great to have more and more of those, for sure. But I believe that was our final one. Thank you so much indeed, everyone, for joining us tonight, for your questions, but also for listening. I do believe that it has been helpful for you. And Vanessa, thanks a lot. And as you can see, things are coming up your way.
Thank you. That's really nice. Thank you.
It's definitely really great to have you here. And I just also want to mention that Vanessa, she's providing some talks on donor conception network. So of course you can have a look, Google her, and there will be some available, of course, as well. Sorry, there is a question for me, I guess. Yes, you will be able to see the slides. Okay, it has been recorded, so tomorrow it will be available on our site. Okay, my IVF answers, so you will be able to have a look at the recording, and you can always share it if someone might find it useful as well. So thank you so much, everyone. Vanessa, it's been great to have you here, and as I've mentioned, it's been recorded, so you can also go to our YouTube channel. If you subscribe that way, you will be notified that the video has been uploaded. And as you know, there are more events coming up. Tomorrow we will discuss again IVF legislation, this time in the Czech Republic. So if you are free at 7 p.m. UK time, you can also join us and find out some more. Once again, Vanessa, it's been great to have you. But before we finish, is there anything else you would like to add?
I would just like to wish everyone luck on their journeys, and I hope that you get the baby that you deserve at the end of it all.
Yeah, that's why fingers crossed, as always, to each and every one for you. Just hope that it's going to be a happy ending, right? Thank you so much, and have a lovely, relaxing evening, everyone. And I do hope to see you tomorrow right here as well. Thanks. Take care. Bye.